I'm glad you're here. On this channel, we break down and simplify all things medical. My name is Irene Oira. Today, we are going to discuss a very interesting topic. I'll be talking about 6 medical advice that we misunderstand. Number 1 advice, take 8 glasses of water every day. So this advice is commonly misunderstood in that different people interpret it differently. Some people think that the 8 glasses are supposed to be taken in one sitting. No, that's not the case. This medical advice of taking 8 glasses a day basically means taking the 8 glasses in a day. You can choose to go about it in 2 ways. One, you can spread the number of glasses within the day, within the hours of the day. And number 2, you can choose to take sips throughout the day that will be equivalent to the 8 glasses of water. And it's so encouraging that nowadays we have normalized the act of walking with water bottles. It is easy to attain the 8 glasses of water in a day effortlessly. And a point to note, it doesn't mean that for someone who doesn't take the 8 glasses of water that this person is dehydrated. No, it does not equate to dehydration if you don't take the 8 glasses of water. But it's only healthy that you took the 8 glasses of water because your system needs to be replenished, your body needs to be rejuvenated, you need to be hydrated all the time. Number 2 is concerning paracetamols. This mostly goes to people with infants and toddlers in the house. If you agree with me, in most of our homes, you will not lack paracetamols. Some good examples of paracetamols are Tylenol, Panadol for infants, and Calpol, among many others. So when a child experiences fever, and maybe this child is uncomfortable, irritable, or fussy at night, or even during the day, the first thing you're going to run for is that paracetamol that you've stocked up in the house. So you give the paracetamol to the child, the fever is brought down, and the child also calms down. Then maybe the child is able to sleep well. In most instances, we leave the management at that, which is not good because in this situation, you've just dealt with the fever and not the real issue. Number 3, we misunderstand the term emergency. Emergency in medical terms simply means a health situation where there is a possible loss of eyesight, a possible loss of a limb, or a possible loss of life. Okay? Not any chronic illness, chronic pain, or irritability. Most people misunderstand what emergency really means. And I'm going to give an example of what is not an emergency. If let's say I've been having wrist pain and it has been there for like 2 days and the pain is so severe that it limits me to perform my normal activities of the day, maybe writing, lifting, etc. And I choose to go to the hospital, that will not be considered as a medical emergency. So don't go parading yourself in the emergency center for treatment simply because you are experiencing chronic pain. Remember, emergency means a possible loss of a limb, possible loss of eyesight, or possible loss of life. The 4th misunderstood term is rest. Rest simply means avoiding activities that aggravate pain. It's not avoiding movement or any activity altogether. In this instance, you should allow your body to guide you. What do I mean by this? When you take part in a certain activity, then you feel that this activity is resulting to some pain, maybe during or after. That is an indication that you should not participate in that activity. Even when you try to do something that looks so light, then you feel in your body that this activity or this action has triggered some pain in you, then it's an indicator that you're supposed to stop that activity or you change the way of tackling whatever you wanted to do. Medical advice number 5 that we misunderstand: watch your weight. This simply means do not add or lose weight drastically. It's not healthy. That's not what the doctor meant. Everything should be gradual, in simple terms, for that advice. Number 6 that is commonly misunderstood is about CPR. CPR is the abbreviation for cardiopulmonary resuscitation. So if you find yourself performing CPR on someone, please note that CPR is not done to make the person wake up, but CPR is performed to sustain the vital bodily function. So make sure that you perform the CPR until you can get the person to hospital.